Well, Sam, let me turn to you. What is the state-of-the-art resuscitation science right now? I mean, if you had the perfect conditions, what techniques do you throw at this person who's come into the hospital after cardiac arrest?
Well, you see, I mean, to take one step back, there's a lot of research that's been done that shows how a person whose heart has stopped should be resuscitated. And that essentially can be summarized into two phases. One, during the period when the heart is not beating, and then if you restart the heart, the period after that. But unfortunately, what is very sad, and I think it's a tragedy really for society, is that these systems are available, the knowledge is out there, but they're not implemented, which is why it was interesting when Lance said, we're all believers. It's like a religion. You know, you're in the religion of cooling people or you're not. And the sad reality is that data from the American Heart Association shows that less than 10% of people in the US today who are eligible for cooling therapy after their heart's stopped and been restarted actually receive it, which is astonishing to me. We wouldn't tolerate that for anything.
Because a lot of hospitals don't have
it's not even that they don't have it, it's just that people have not implemented it. It's a complicated question that maybe the others, Lance can answer that. But it is a sad thing. And then to answer your question, what in the ideal world would we do? Well, we'd have, in my opinion, we'd use machines to deliver chest compressions far above and beyond what any human being can do, because most of us get tired very quickly. We cannot deliver it. We would pay attention to the blood pressure during this time, and then we'd observe how much blood and oxygen is getting inside the brain and making sure that we're delivering the right amounts. And after we've restarted the heart, it's important to put together a whole program of things, including cooling, including reducing the oxygen rather than cranking it up, as Lance said, paying attention to the blood pressure, and various other parameters that if you do that together should improve people's chances of coming back without brain damage.
So it sounds like part of the trick here is to figure out how to reintroduce the oxygen and how to warm up the body. I mean, those are not simple matters. Stephan?
Yeah, no, absolutely. The, you know, if interesting statistics, and I have some experts here, so this is my reading. We all die. 20% of the time, the mode of death is what I call thud. So it's sudden cardiac death. You suddenly collapse, right? If an EMS crew, right, so if there's no one there with you, that's going to be it. So you have to have a witness, an observer, a first responder to call 911. And you need bystander CPR. Then EMS comes. In most large cities in the US, including New York, when EMS comes and tries to do the CPR and pump on the chest, you know, the experts come in, right? They're actually declaring the person dead in the field 80% of the time. 20% of these people, the lucky ones, their heart's now beating, they get put on a ventilator, they get taken to an emergency room. So this is the amazing statistic. In New York City in the early 1990s, if you were one of those lucky folks and CPR worked and you're being admitted to a hospital emergency room, guess what percent of those people were discharged alive? You know, lumbar, right? 1.5%. So it makes you think, what, you know, what's the point of doing all this stuff, American Heart and CPR and everything else? But those numbers are really increasing now. So Sam does speak to the fact it's frustrating for us as true believers. You know, let's go, right? We can do so much. But with the implementation efforts that we've seen, there's been some really exciting stuff in New York City, actually. You will be taken to a hypothermia-ready hospital now in New York, and that's just 3 years ago. But now for out-of-hospital ROSC patients, we're 5, 10, 15, and in optimal conditions for the shockable heart rhythms where they get great bystander CPR, great post-resuscitation critical care. We're getting that number up to 40%, which is amazing. But we still have a long way to go.